With us today, we have the Chief Medical Information Officer from Penn State Health, Dr. Chris DeFlitch. Chris, it is good to see you again. Welcome to the show.
Hey, Will, thanks for having me.
Yeah, absolutely. Thanks for taking the time. I wanted to start a little bit today just talking about your background. Give me the Dr. Chris DeFlitch origin story. How'd you decide to get into medicine, and then how'd you decide to get into emergency medicine?
So I wonder if you're asking an origin story, does that mean I'm a villain or I'm an Avenger? I'm a little confused about that.
That remains to be seen. We'll see how this goes.
Sometimes a little bit of both, being a CMIO for 20 plus years. So I'll give you a little background. I'm a Western Pennsylvania guy. As you can tell behind me, I'm a Steeler guy, born, raised in Pittsburgh area. I did my undergraduate in a small school in Erie, Pennsylvania called Gannon University, where I got my degree in physics. Was lucky enough to join Penn State College of Medicine for my undergraduate medical education. Never had any technology interests really other than thinking systems and I was actually a couple credits short of a mechanical engineering degree as an undergrad too. And my mind was always sort of thinking systems, but wasn't a technology guy. Ended up in the early 90s going to UMass in Worcester for my emergency medicine training. So I'm an emergency physician. And for some reason, ever since I was a little kid, I always wanted to be an emergency phissician. I'm lucky enough to be able to do that. Finished up in the academic center, saying to myself, there's no way I'm ever going into academics ever again. Went and worked in the community hospital, actually the hospital I was born in Western Pennsylvania, for about a year.
Yeah.
And then literally 25 years ago this month, came back to Penn State. So I've been at Penn State Health and its versions. Initially, it's just the Hershey Medical Center, but now the larger Penn State Health for the past 25 years. Done everything in emergency medicine, from creating an ED without a waiting room, to helping convert from paper to electronic most of our health systems over time, converting from Epic to Cerner, and a whole bunch of other conversions over time. So I've, in my that's my sort of healthcare life. I initially was practicing a lot of clinical emergency medicine. I still practice. I practice once a week at the Hershey Medical Center. On Thursdays, so I still love taking care of patients, but my primary job here is of CMIO, and had actually a really fun journey in research and informatics, and a fun journey in training and educating folks, and doing some good things for our college, and I think making a difference.
Yeah, I've worked with you long enough to know that you are, and Penn State is definitely lucky to have someone like you. It's very rare in a CMIO where you have the combination that you do in terms of tenure at one location, and then a lot of credibility and experience both on the clinical side and the informatics side. They're really lucky to have you as part of the system there.
Yeah, listen, anybody who's going to put up with me for 25 years, then you're not my wife. God bless you. Like most of us, we're, so energetic and trying to get things done. And in the early years of doing, physician champion things before there even such thing as a CMIO even existed, trying to help people understand how technology can help improve process and improve things. There were lots of promises back in the day, 25 years ago, about how that would happen. And I think, as we've all grown up into it, some of that has come to fruition. Some of it has just been an absolute failure. I think as we pivot and learn as to what is best for our patients and what's best use of technologies, some things have stepped into it. Electronic records are kind of a basic expectation of everything now, whereas 20 some years ago, it was sort of the new kid on the block.
Yeah.
I think, again, we talk philosophically, but I think that, there's that practicality in the business as CMIO, but there's also the importance in education and training. So as a professor in the College of Medicine and a center founder and a center called CHOT, where we study healthcare delivery science and how does technology impact the practice of medicine, how do processes and people adjustments impact the use of technology, what's the right role for people. It's been really fascinating to mentor literally over 100 students, PhDs, MDs, master's students in healthcare delivery science, and really start developing that thinking about not just technology itself, but the use of technology and the people and processes around it and how it impacts, our family members as we care for them.
Talk to me a little bit more about the technology piece. And I know, we talked before about electronic medical records, and I think that one's been well discussed. Talk to me more specifically around communication technology and how you're communicating and collaborating across your organization.
I think that's key. I mean, anytime anybody's been through a sort of quality review of cases or how systems are affected, communications is sort of the number one thing on the list. It's been very fascinating over the years to watch this happen, where without technologies, people actually talked with each other. They would pick up the phone and ask for something, and there was that sort of human interaction. I think more and more there's technology intermediaries in there that are helpful and hurtful in some ways. So, people communicate through electronic records in ways, whether they're, inboxes or message centers or whatever each vendor calls them. It's really about that communication. But it's an email, right, effectively. And it's not really synchronous, and you don't know, is there a response or not a response? I'm an old school guy, and I still pick up the phone and talk to people whenever I have a question. But more and more, we've been involved with more advancing technologies like texting and like enhanced video interactions, both with patients and providers in regards to telehealth. And so I think that there are platforms and opportunities for quality communications, bidirectional. I think that's the key in both the video space and in the texting space. Again, I'm still a big fan of picking up the phone and talking with somebody, or talking with 2 or 3 people at the same time, so that we're all collaborating. And I'm talking especially in the setting of clinical care, that we can get everybody on the same page, so we're taking care of the patient in the same way. I mean, anecdotally, one of my family members, extended family members, got sick over this past weekend, and with a quick conversation, went from a family that was completely freaking out about what turned out to be truly a life-threatening situation, to talking them through it, to having the conversation about what our next steps in care. And then as we moved on, texting back and forth to keep that communication back and forth, up to now them surviving this past weekend and going to a longer term rehabilitation facility to finish out their convalescence. I think 20 years ago that didn't exist. I'd had to get in a car and drive to Pittsburgh, which is a good 4 hours away. It's become expected in I think my kids' level of communication, that their primary desire is for quick snippets and for texting back and forth. And we've been partnered with Tiger Connect here for a few years now, and while I think it started off as how the heck do we use this and where does it make sense, and you always get these early adopters in any conversion, we're now to the point where we're looking at the numbers a little bit, 2 million plus texts a month. That is essential to the communication strategies in 3 of our 6 hospitals, and the other 3, are converting very rapidly, to the point where by the end of this fiscal year, it'll be our primary texting platform.
That's a lot of messages a month that are going back and forth. Any sense, as you have observed, over time and worked at Penn State and used the technology yourself, what's gotten better? What's improved?
Connectivity's improved. The importance of the bidirectional nature, I think, is really important. Pagers is that sort of long-standing, 1980s technology that people hold on to, that say, "Oh, I've always used it this way." And then, once they realize that they don't have to carry around that device, they already have a smartphone in their pocket previously, and they understand that the application can do what that device did is sort of the aha moment for most of them. I'm continuing surprised that in some areas they're it's so important to hold on to something that's tangible, like a beeper for some people, like a local network phone as opposed to a smart device. That the mentality shift from the device doing it to the application doing it is a little bit hard for some people to understand. And so the way I think we've seen it, you're going to have your early adopters. They're going to grab to it no matter what. You're going to have the people who really understand how to improve process and the use of technology. They're going to gravitate to it because the technology is really easy to use. And, if you leverage the roles and the teams and all the capabilities that are associated with it, you can improve, some specific things. But then you got this sort of, last third and the laggards, which is kind of where we're at in our organization, is to say, how do we get the rest of the organization moved towards that? And it's a different transformation technique. And back to the old guy CMIO thing, right? Our first foray into informatics and CMIO worlds were converting electronic records. Then we talked about optimization of those records. I think nowadays, your more advanced CMIOs are at the executive table sort of talking about how do we improve the outcomes of our patients? How do we improve the gaps in care? How do we leverage the technology to improve the opportunities for care we have across our organization? And again, communication technologies are key to that. Video technologies are key to that. Ease of use of the electronic record and other peripherals are key to that. And as we mature as an industry, and as more and more of the technologists understand the importance of the informatics piece of it, and as the clinicians and business folks understand the importance of the informatics to be able to enable them to do all those things, you'll see the development of informatics that some of us had vision for more than a few years ago.
We talked about how convenient this technology is, how clinicians are happy with it, how it's definitely made their lives easier. Talk to me a little bit about some of the clinical and perhaps operational improvements that you've seen.
I wish everybody was happy with it. They're not. People are not. But generically, people don't like change. So folks are, some are coming kicking and screaming. That's the reality. But most people are understand once they use the technology, like, oh, geez, why didn't I do this before? It was just that change management and resistance to change. I think we've tried to use the technology to enhance the experience. And, I focus in on the quality and safety aspects of things more than that includes experience of the providers. So actually in our community, the facility radiology interpretations and actually laboratory results, we set up different roles within both the community radiology services and the different laboratory services, that instead of it coming from Dr. Smith or Nancy Jones, it's coming from critical lab results, hospital A.
Yeah.
It's coming from critical radiology results, community. And so when I see that text, it puts it in context for me. It's still, Nancy Jones and Dr. Smith that's sending it ultimately, but that's not what I see as receiving it. So all of a sudden, without really doing anything, I'm looking at a text with a completely different context than I would have before.
Yeah.
Imagine you got that in a beeper, right? It would say 1, 2, 3, 4, 5, call me, or something like that. So all of a sudden I've got now 4 or 5 minutes of work, as opposed to I can look at this and I can see, I'm like, oh yeah, that's for real, and I got to do something with it. Or I look at it and say, no, I knew about that already, and I can just bypass it. I mean, that's a seconds as opposed to minutes conversation. And it makes, the patient care, I think, a little bit more effective, and it makes me as a physician more efficient.
You talked a little bit earlier about, your role as a CMIO and being very much connected to the executives in your organization and part of the executives. And I've worked with other folks and other CMIOs, and I'm sure you have as well, where that's not the case. They're really more part of the IT team. How have you made that connection? And what are the things that you track and that you think about, and perhaps the the metrics that you drive to as a CMIO that makes you important and relevant at that senior executive level?
I do report through IT. So I report to the CIO, Cletus Earl. I think part of that is our leadership team at Penn State Health with Cletus and the other folks that he's brought in with Chief Applications Officer, Chief Technology Officer, Chief Data Officer. We work very closely as a team together. So it's really that unified approach. It's not and I'm at the table as sort of the technical clinical voice.
Right.
I've had roles as physician leaderships in a couple of different locations. So the folks that are the chief medical officers or the VPMAs of the different organizations, I sit with them as part of their forum. I sit with the chief nursing officers as part of their forum, and with the senior executives in regards to that. It's not rare. Some of the guys will pick up the phone and say, "Hey, Chris, we've got somebody who's in the emergency department over here. Can you come help me?" They know I'm an emergency physician. I've been doing it for 25 years. I've taken care of more people than I, care to say. And so there's a level of personal trust there. And they know I'm in it for the right reasons. I mean, I very rarely talk about technology for the sake of technology, because that's not why we do things. There are some cases where, old pen and paper or picking up the phone and talk to somebody is much better than any intermediary technology. I always say that healthcare is about people taking care of people. It's about the physician and patient in space and time. And that can happen in the ED. That can happen virtually now with really good telehealth. That can happen, with phone calls. But you can't lose that personal touch. So I think that one of the reasons I've been lucky enough to have that conversation is, I put in my time. There's part of that. I've been successful with the help of my team and others over a period of time. And they know it's about the right thing to do for the patient for me. No matter what I say or what I do, it's about the right thing to do for the patient. And I won't go into great detail, but when we first selected our EMR vendor, literally in the early 90s, I was on the search committee as this young buck who wasn't afraid to share his opinion. And when we did the roundtable and they asked, okay, what vendor you want to go to? I said, well, vendor A has a much better user interface and I think would make more sense if we're only focusing on the docs. But vendor B at this point in the development made a lot more sense for our entire organization because they had some stuff that, that the nurse could use. They had stuff where I could get results back to me as a physician. Maybe my user interface to the physician wasn't quite as good as the other one, but it was about how we together can take care of patients. And to me, that theme of doing the right thing by our patients, doing the right thing by our system has always carried me forward. So anytime there's hard decisions or, anytime there's sort of what's the right thing to do, I think about what's the process, how does it affect the people, and would this be good for, my dad or my cousin or my extended family member who, was just ill. And so that's sort of my north. I think people appreciate the honesty because there's times when I'll say, it may be unpopular, but I don't think we should go in that direction because, while it may enhance one part of our org, it probably is not the best bang for the buck for another area. Ultimately, like anything else, like any, a personal or business activity, it's all about relationships, right? And how do you help each other out? I know it's a long-winded answer, but I think over time I've been able to understand the technology enough to speak to the technologists. Obviously, I'm a physician and a clinician, so I can speak to the clinical folks fairly easily. I've learned a lot of financial information. So when we're talking about finances, we can help translate that for the folks who are very focused in on the finance. A lot of times we as informaticists are translators between the clinician and the IT folks or the business and the finance of this. Yeah. And because we're clinicians, we always have that sort of, I think, true north, that moral compass that says it's really about the patients and how do we get folks to the point where it's about the patients. And I think it's one of the reasons I stay at Penn State Health and have been there for such a long period of time is because I think we have the people here that care about that stuff. And while there have been people come and people go, People come in with different perspectives, and I think we're seeing a lot of people who care about the right things to do, and I'm kind of lucky enough to work with folks like that.
Yeah, and I think that really resonated with me when I visited. Was everyone was driven by exactly what you just said. It's ultimately what's the right thing to do for the patient, and that really comes through at Penn State.
Yeah, and
And
it's hard stuff, right? I mean, the healthcare environment's tough, right? Getting access to the right care, being able to contact somebody in a way that is value added for everybody involved. It's just getting harder and harder and harder. I think we learned a lot through COVID. But there was it was just an absolutely horrendous time for everyone involved in the pandemic. But there have been a few things like telehealth, like like near synchronous communication technologies and texting and video chat that had got us through it. And now folks who may have been more resistant to that use of technologies are now saying, "Oh, geez, well, why not this?" I mean, we opened up 2 new hospitals, literally brand new hospitals in the last little over a year, and we have people that are willing and able to think a little bit differently because you're in a new physical plant, and working with some of the cardiologists to truly have a hybrid visit where the only time the patient is spending time face to face is a physical exam with a physician. Everything else is being done either asynchronously or synchronously on video. So there's no reason why we can't do that in many locations. There's no reason why in many locations we can't completely virtualize it and have the patients in their home. I think I'm talking a lot here, but one of the things that we're really looking into is some people call it social determinants of health. I call it social indicators of health because I don't think it's a predetermined activity. I think there's opportunities for folks to intervene where there's the needs of populations, and as we get more and more mature with the secondary data aggregation and connection to other industries and other resources, I think we as health systems have the obligation to be able to make those connections between patients and groups of need with organizations that can actually improve their long-term life and outcomes. That's not necessarily your traditional transactional clinical visit, like an ED visit or a surgery or something like that, but that longitudinal care that actually improves the lives of a family that is facilitated by Penn State Health. I think there's a lot of opportunity there. So I think what we're going to see, at least from us in the next coming times, and probably from others, is how do we make that work for our communities that we serve, and how do we use these technologies that are now ubiquitous, whether they're Tiger Connect or telehealth visits or EMRs or whatnot, in a way that improves the lifespan and outcomes of families in our region. And I think it's part of the obligation we have from what we've learned over 20 plus years of doing this stuff, but also what companies like Tiger Connect are willing and able to do with us to be able to say, we've done some really good things in healthcare, and communications have been enhanced, and the ease of technology use the burden has been decreased. But what about everybody else? What about those, the people who maybe do have a smartphone, but don't have a ride to the doctor, or, have food insecurities, or maybe they live in an area where, the safety of the water is not quite where it should be. How can we, leverage these technologies, leverage our expertise in healthcare delivery science to be able to improve their lives? And I think as we think about things, we allow ourselves to think about those things coming into the future. I think we're obligated to make a difference there, and I think this next generation of our employees thinks like that automatically. Is a very important social connection to how they purchase, to how they use technologies to do this, and it's really the right thing to do. So us people have been around doing it and can tie into that, that great thought of the next generation coming up, and how do we bring that together to help people in need?
Yeah. Well, Chris, really appreciate you joining us today. You've been so generous with your time. Thank you so much for sharing your perspective It was great to see you again. We'll have to have you back on here sometime soon.
Yeah, that sounds good, Will. Thanks for having me. Thanks for allowing Penn State Health and myself to have this forum to be able to talk about some things that are important to us.